Good evening, I'm Clarice Tinsley. The Dallas nurse who contracted Ebola says she is doing well and she thanks everyone for their prayers. Nina Pham released a statement from Texas Health Presbyterian Hospital where we just received an update that she is in good condition. The Centers for Disease Control identified 76 of her colleagues who also had contact with the first Ebola patient, Thomas Eric Duncan. They are now being closely monitored. Two of the health experts who treated Ebola patients, Dr. Kent Brantley and Nancy Wright-Bull in Atlanta, will work at Presbyterian in Dallas. Fox 4 Sean Rabb at Texas Health Presbyterian. Sean, a lot of developments today.
Yeah, quite a bit came out today. We now know there's another pool of people to be monitored. There's good news about that first group of people, the 48 who have been monitored. Great news about Nina Pham's condition today, that she's actually listed as good, Clarice. And those Ebola experts who are now on the ground here are here because we learned today that for now and going forward, through this virus season anyway, Presbyterian will be the Ebola hospital in Dallas.
Nurse Nina Pham contracted Ebola virus trying to save the first person to die in the U.S. from the disease, Thomas Duncan. Pham among a large number of Presbyterian healthcare workers involved in Duncan's care, now being closely watched by the CDC for 21 days.
At this point, the team has identified 76 individuals who might have had exposure to the index patient. Of those 76 individuals, all will be monitored for fever or symptoms on a daily basis actively.
And any person who develops fever or signs of sickness, no matter where they are, will be taken to Presbyterian, which now becomes the official Ebola hospital in Dallas.
So that is our place where we have prepared the team, where we have the team focused to beat Ebola. And I want the people to go there. There is a secondary concern because of public misinformation and panic. That hospital somehow has Ebola floating in it, and I don't want to see that spread to other hospitals.
Over the last 2 weeks, Presbyterians had a huge drop in other patients, people canceling elective procedures and self-selecting to go to other hospitals that are now overflowing.
It's not especially Baylor and Parkland, it's all of them. You know, Medical City's seeing a big load increase too. When you have more people than you're scaled, than you're built for, then you have to try to scale up with more doctors.
Including the 4 people Thomas Duncan had stayed with in a Northeast Dallas apartment, some 48 people were identified as contacts. None have shown symptoms through 2/3 of their risk period.
They've all passed more than 14 days, and while it wouldn't be impossible that some of them would develop the disease, they've now passed through the highest risk period, and it's decreasingly likely that any of them will develop Ebola.
While that's good news, the CDC still doesn't know how Nurse Nina Pham got sick.
We don't always come to a conclusion, but we always identify things that we can do to improve the process and improve the safety of healthcare workers there.
And to improve the safety of healthcare workers here, there are some nurses from Emory Hospital, Atlanta, who are now on the ground here. These are nurses who successfully treated Dr. Kent Brantley without contracting the virus. They're going to train nurses here at Presbyterian, Clarice, how to put on protective clothing and how to care for an infectious patient as well.
Sean, the 76 healthcare workers who are going to be monitored every day for 21 days for fever and symptoms, what can you tell us about them?
Well, pretty much it's anybody and everybody who went into the room where Thomas Duncan was, doctors, nurses, techs, those folks who took blood, who analyzed urine. It's everyone. And again, it's because they're not sure how Nina Pham contracted the virus. And so, if it were through the PPEs or whatever, they're not sure. The personal protective clothing, they're not sure. So they're going to monitor all of these people over that time frame and see if anyone else gets sick. But there was a note of optimism in the voice today of Dr. Frieden, especially at the improvement in Nina Pham's condition.
All right, Sean. Sean Rabb at Texas Health Presbyterian, thank you.